Welcome back to the news review segment of the Power Breakfast Show. We are joined in our panel of the earlier three, Mheshimiwa Jogu Barua, Mheshimiwa Gladys Wanga, and Mheshimiwa Joy Gwendo. We are now joined by Dr. James Nikal, Member of Parliament for Seme constituency. Mheshimiwa, you took a while to get to us. Were you still looking for your certificate or something?
No, it may be the aftermath of the certificate, but not actually look for the certificate.
So you have a certificate?
I have a certificate.
Which one?
ODM certificate.
I mean, we have seen ODM give more than one certificate for one position.
I'm thoroughly convinced that the one I have is that.
What's this all about?
But the ODM did not give more than one certificate.
The others
really,
are
Gladys?
Okay.
No.
Okay, ODM election officials or nomination officials gave more than one provisional certificate in not one instance. Now, do you agree?
Provisional? Yes. The actual certificates have only been given to one person for every electoral area. Just one.
Now that you're defending this, why are you giving more than one provisional certificate?
No, you know, provisional certificates were copies. You know, there were some photocopies. So some people were not even given those certificates. They just said, now that somebody else has won and gotten, let me also prepare, and maybe I will rush to Nairobi and get this registered, and maybe I might get the original certificate. Because they were thinking, like what happened in the past, you know, where the first person to reach Nairobi might have been the person to get the ticket. And they were shocked, because this time it was not the first person to reach Nairobi. This time it was about what happened on the ground, especially at MCA, MP levels and so on. So they did not get any headway here. They just came with their thing, and then they realized it was just a piece of paper.
I know we want to get into the issues of IEBC, trying to clear any aspersions cast in their integrity. But before then, Daktari, shortly before you came in, we were talking about issues about industrial dispute management, the issue of the teachers' pay deal now being discussed by Teacher Service Commission and the unions as a way to bringing an end the regular stalemate we keep having. And Mheshimiwa Wanga here raised the issue of how the Jubilee government has handled industrial disputes, the issue of doctors, the issue of teachers. What's your take, being a doctor profession, having been a director of medical services?
My take is that when you get into industrial dispute and you're discussing it, there's a basic principle that we all must adhere to. The discussions must be sincere, and there must be the intention that what is reached will be implemented. If you don't do that, then don't waste time. In my view, what has happened with the doctor strike, you go back to 2013 when there was some agreement. The same with the teachers, 2013 there was some agreement. I tend to think that these were things that were being done perhaps to appease the people towards an election, the people involved. And if you do that in anything in life, that thing will fail, because the truth will eventually come out. And so when we have agreed with these agreements, I think it is better to have even a very difficult, prolonged negotiation, or whatever is agreed must be implemented. I am very unhappy that in some places doctors have not been paid. Whatever return to formula work was agreed on is not being implemented. You're calling for problems again.
Already we have instances where doctors are trickling back to the streets.
Yes, I've read, and I don't know why people don't really see one thing in life, that the truth will always prevail. If you do not stick to what you said, what you are trying to resolve will go back to where it was. So I think the main thing here is we have to be sincere, we have to have integrity when we are having these discussions. However hard they are, we have to look at the facts. We have to agree that we will pay this, and we pay it.
Your opinion on the new drug to check on the spread of HIV/AIDS, the prophylactic medicine?
Well, anything that is prophylactic is good. It's only how it is used. If you are not careful and you have it, and then people now go haywire, there's prophylaxis, I'll just do this, and then because the medicine is there, I'm safe. It will not work, because if you look at any medicine, any medicine at all, it has a level of efficacy, meaning if so many people use this drug, this number will then be protected. I don't think it can be 100%. Even if it is only, even if it is 99% effective, if there is massive use and it is used carelessly, then that 1% will be significant in the spread of the disease. Therefore, the main thing must be the other behavioral ways of protecting oneself.
And behavior is social. That comes from a professional medical expert. None of you here, ladies and gentlemen, are professionals in medicine, but you're professionals in behavior and social issues. Your take on the introduction of this drug, Mheshimiwa Barua?
I think
a drug that helps prevent contracting HIV.
I think this is a good drug for people who are in a relationship and happen to be on the opposite sides of the status. If a man and wife are in different types of positive and negative, this is something which is very positive to me, because it can maybe ensure that they continue living the way family should, or man and wife should live. But as the professor is saying from a professional point of view, is that if especially the youth come to a point that now we have a solution, we can go haywire because there is no risk, because that is possible, then you might even end up getting more infections than before. Because before this drug there was a lot of care, I assume, but now with this supposed control, people can say, now I can do this and protect myself with this. I remember when you were in the university, sometimes when these ARVs were introduced, this is a rim and the way students used to behave. There are some students who used to say, okay, if I do take ARVs before, I might be secure, out of ignorance. So what will help us is how responsibly do you utilize this drug.
So the behavior change.
Behavior change is very important. If we don't use it in a responsible manner, it can end up being disastrous to this nation or to anybody who uses it.
Mheshimiwa Wanga, your take on this?
Yeah, I want to agree that the pre-exposure prophylaxis will help us a lot with discordant couples. But I think the caution is there about people using it then rampantly, and saying that I will take my PrEP and then go out there and do whatever can be done, or eat life with a big spoon. But this is a major. It's a major. I think studies have been done over time. I was in HIV before coming into politics. I worked with LBCT Health, so I have followed the studies of the PrEP, and now I'm glad that it is now available on the shelves and it is now here with us, and people can actually access it. People in most need can actually access it, and I hope that government can make it available, because the cost you're seeing there of
they're saying 3,600 on retail, but the generic version is about 413 shillings.
Yeah, that cost might be out of reach for many discordant couples who are in need in the areas we come from, in the villages. This money, nobody even sees it, you know, in the entire month. 3,600, you can't see it with your eyes probably in a month. With the cost of living, where milk is now 65, unga 150, so many families will be wondering whether to go for PrEP or find a way of getting unga. So I think that cost issue is a very...
And they end up sharing, like it has been the case with the ARVs. Somebody says, my supply is over, can I use
yours? Yes, could I use yours? So I think government, just the way it has done with ARVs, should look at a way of availing PrEP at very low or no cost at all.
Let's throw a twist into this, Joy. They have talked about discordant couples. This is a good thing for people in marriage. The risks for the youth, those who are not in marriage already, university students, these days, understandably, even kids, small children in secondary schools engage in sexual activity.
For me, I think as much as it is a good drug, we need to create awareness on everything around it, the pros, the cons, and how we are supposed to deal with it. Because, you know, with anything new, you need to create awareness, you need to sustain awareness, and we need to embrace the fact that every day is a learning day. So if we, you know, tell the youth that, yes, this is the drug, it is going to protect you, but this is what you should not do, and this is what you should do about it. The same way they have been drumming the, you know, weka kondo mpangoni, usikiwe na mpango wa kando, all those things. They should do the same with this new drug. In that way, somebody will be going into something knowing that this is what I should do and this is what I should not do.
Talking of new things, the front page story on Taifa Leo today was talking about Uasi Mlima Kenya, the revolt, or apparently the disquiet among those who lost in elections in the nomination party primaries in different regions of the country. You go to Kisumu, you hear about no Uda, no Uru, and that's where the two of you come from.